Welcome to the Benefits Executive Roundtable, hosted by Dorothy Cociu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new for Season 6 video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening.
Welcome to the Benefits Executive Roundtable. I'm your host, Dorothy Cociu, President of Advanced Benefit Consulting, and I'm really happy to have my guest with me today, Faith Borges, who I've known for a number of years. She is a legislative advocate for the California Agents and Health Insurance Professionals. Welcome back, Faith.
Thank you, Dorothy. It's always great to be here.
Yeah, I really like having you. And for those of you that have been watching or listening to this podcast for many years, Faith has been a guest on the podcast, and she's given us California legislative updates. And I wanted to invite her back because it's just not a season without Faith telling us about what's going on here in California. So again, I'm just really happy to do this today with you. So before we get into all this, I just want to ask you a very basic question for the benefit of our audience, which is both video and audio now. Can you tell us who CAHIP is and what their purpose is?
Of course. CAHIP is California Agents and Health Insurance Professionals. They're the largest trade organization of health insurance agents here in California. Agents and our partners. We did want to make sure we included them in the title. There's trade organizations for hospitals, for the health plans, but really this is the only voice for agents in the work that you do on behalf of consumers, whether they be seniors shopping for Medicare coverage, small businesses, large businesses looking to provide great benefits to their employees, or individuals looking to enroll in Covered California or directly with health plans. Our agents really cover it all.
Yes, absolutely. And I've been a member, as I said, for many, many years. I've been a member of CAHIP. And I do want to tell you this, full disclosure, as I always do. I've known, as I mentioned before, I've known Faith for many years because I'm actually a member of CAHIP. I've been on the board for the state of California. I was a past president in California. I now have stepped away from the California State Board, and I'm acting as the Vice President of Communications and Public Affairs for one of the local chapters of CAHIP, which is CAHIP Orange County. And I also want to thank Faith personally for her time, taking the time to do this today, because she's not only taking time away from her work, but she's also taking time away from her family. And just again, I want to say congratulations, because Faith now has a brand new 5-month-old baby. And I just want to say I'm so happy for you. And I've seen pictures, and your son is just adorable. And I just want to say thank you for taking time away from him to do this for us.
Oh, thank you so much. And I'll make sure he tunes in, your youngest listener.
Yes, absolutely. That would be fun. I would like to get a video of that maybe when you're doing that. Send me a picture or something of that. And then maybe you can show it to him again in a few years and see how he responds. But that would be great.
Sure.
Well, let's get into this because we do have a lot to cover. A lot's happened since the elections in November, of course. Everybody knows that Trump shocked the nation with his win, pretty much, winning the electoral votes, of course, the popular vote, and winning all of the swing states. I don't think anybody could have anticipated that happening. But I was wondering how you feel about this, and what do you think that presidential election and everything that went with that presidential election, how did that affect the state of California at all? What are your thoughts on that?
Well, I'll have to answer first like a lobbyist. I'm not inclined to state my personal feelings, but I will share that as a professional and frankly as a political scientist, I am very fascinated by this period in history. I think it's going to be one for the record books for sure. California has a unique relationship, I would say, with the Trump administration. You know, this isn't our first time go around, and Trump 1.0, California really became the ground zero for the resist movement. And then California was equally positioned to do so for the second time around. In fact, California called a special session when Trump was elected that was specifically targeted at providing funding for California to sue the Trump administration on any myriad of things. Certainly healthcare would be included in that. Very similar to how they did 1.0 when there were, infinite lawsuits going back and forth with California's response to any federal actions. That has really changed since the fires here in California. Right around the same time as inauguration, California experienced historic wildfires. And what initially was a very confrontational attitude has turned into one, frankly, by necessity of collaboration. We're seeing collaboration right out of the gate with Governor Newsom and with the Trump administration. And frankly, there's a lot humbler tone associated with the communication from California and the federal government. Part of that is also tying into our budget activities here in the state. Our California governor is required to really lay an outline for what he would like to see the state spend money on at the very beginning of the year by January 10th. He's constitutionally required to do so. That coincided with the fires happening. So what he'd initially prepared as a budget that looked fairly healthy, in fact, there was a very small budget surplus, a few $100 million, is basically out the door. The governor said, take that entire plan, throw it out the window, because with the direct need for all of those impacted in Southern California, all of our resources are going to have to go there. And I think we're going to be talking a little bit later about why that's important as we talk about issues of healthcare and what it means for deficit spending and ongoing budgetary commitments. But the dynamic is certainly still, I wouldn't say surprised. In fact, there was a lot of polling pointing towards President Trump being reelected, but one that is evolving.
That's a good way to put it. Thank you very much. Well, let's talk about California and our state and local elections here. Can you tell everybody about the current Democratic-Republican split in both the Assembly and the Senate, and also in statewide offices throughout the state of California?
Sure. And I'm so happy you asked, because I think a lot of times people's politics really get swept away with the national, talking heads and pundits, but really so much of what happens, certainly in healthcare, really is occurring at the state level. Here in California, we have term limits, 12-year term limits for both of our houses, very similar to DC, where they have Congress and the Senate. We have a Senate, and we call it the Assembly. And all of our elected officials have those 12-year term limits, though the Assembly, very similar to Congress, has to run every 2 years, as opposed to the senators here in California that get a little bit of a break and they have to run every 4. Our election outcomes are very different than DC in terms of there not being close races for the most part that, hinge the balance of power. Are the Republicans going to control or the Democrats going to control, that we saw at both houses of the federal legislature? That doesn't occur in California. California is blue, 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 blue. In fact, the balance of power is really more indicative of what type of blue you are. Are you from LA? Are you from San Francisco? Are you a progressive? Are you a moderate Democrat, which we see a lot more prevalently in your area down in Orange County or in my area of the Central Valley? That dynamic. So the numbers in California have been pretty consistent for the last few election cycles in terms of legislative makeup. There's 60 Democrats of 80 seats in the Assembly. So 60 to 20. And then in the Senate, where there's half of the members, there's 31 Democrats to 9 Republicans. So there's every now and then a little bit of excitement with somebody in a seat, again, usually on the Orange County area, maybe San Diego or Central Valley, maybe switching parties, maybe the seat flips there. But for the most part, that legislative makeup's been pretty consistent here for the last decade or so.
And is California, are we still in a supermajority scenario?
Very much. Yeah. Supermajority, meaning one party has more than 2/3 of the legislature in each of its houses, which they have the Democrats in California have every statewide office from the governor on down, the insurance commissioner, superintendent of public instruction, all of those seats. And then over 2/3 of the Assembly and the Senate, which is important as a metric, as we've discussed for your audience before, because 2/3 is the threshold to increase taxes in the state, and 2/3 is also the threshold you would need to overturn a governor's veto. We don't see that occurring here in California when you have same party control. We haven't seen folks try to, overturn one of Governor Newsom's vetoes, but it's something you would more likely see, or certainly did see in the days with a split legislature when you had Governor Schwarzenegger, and then of course Democrats still having control of the House. But those are the reasons we look for it. It's also the vote requirement for passing something with urgency. So typically laws that are passed before the legislature adjourns, which here in California is around September, don't become law until January of the following year, unless you declare a matter to have urgency. So something like wildfire victims, needing additional support, that would be something that merits urgency. And if you have a 2/3 vote, you can pass it and it'll become law right away instead of having to wait till January of the following year.
Well, thank you. That was very helpful. A lot of people don't understand really what it means to have a supermajority. So I'm glad that you explained that. I know you explained it in previous podcasts as well. Are there any important healthcare or health insurance related state laws that went into effect this past January 1st, 2025, or soon to be in effect that our audience should be aware of?
Yeah, California has had some budget downtimes, and something to be aware of in California, again, very different than the federal government, is we can't deficit spend. You can only spend what you have available. Now, does California do some very creative borrowing or deferring? You know, a lot of people are aware of our pension obligations and those types of woes being an example. But by and large, you can't make additional commitments when you're in budget downtimes, which we've had the last few years as we've struggled to recover from COVID and for the economy to get back up and going again after that very large influx of money we had coming from the federal government when that first started, which hard to believe it's already been, we're 5 years out. That said, in budget downtimes, we don't see a lot of new benefit expansions, but there was one to be aware of that I would raise for your audience, and that's Senate Bill 729. First and foremost, it's notable because it was carried by Senator Menjivar, who is the new chair of the Senate Health Committee following Senator Roth's retirement, because again, those term limits. So this is applicable to treatment of infertility and fertility services for large group. So this bill is requiring a health plan that's sold in the large group market. So for more than 100 covered individuals, they have to provide for coverage for the diagnosis and treatment of infertility and fertility services. There are some limits in terms of the amount of retrievals and transfers that need to be covered, and that's in accordance with the American Society for Reproductive Medicine and the guidelines that they've set using a single embryo transfer, because when we're talking about this type of treatment, there's always the risk and frankly, the cost associated with the birth of multiples. So that's something your large group folks are going to want to be aware of, because that did take effect. It's good for your folks to be aware of. And though it did become law, it does have a delayed implementation to July 1st of 2025.
Okay, that's good to know. My own attorney, Marilyn Monahan, actually, she has been advising our clients of this, and I think she mentioned it in one of her additional updates on a prior podcast as well. So I'm glad you brought that up to remind people about that. It's very important that people are aware of that. Now, a large part of the CAHIP budget each year, of course, is for legislative activities. They do have to pay you, of course, which is money very well spent. Can you tell us how important the legislative role and the role of someone like you, a legislative advocate for CAHIP, is not only to the brokers in the state of California, but also to the consumers and basically all residents basically in California? Can you tell us a little bit about that?
Well, I hope at least for my client, my work would stand for itself. But for those of you who are not familiar with me and the work of the association, California introduces over 2,000 bills a year. Business owners like yourself don't have time to read 2,000 pieces of legislation, and then certainly to engage with 120 legislators and the governor's office, regulatory bodies. And so it really does help to work with a professional who's doing that through the lens of the agent and the consumer that you're working on behalf of. Because really, I don't know an agent that is not concerned with the growing cost of healthcare, with any issues restricting access, and making sure that healthcare is quality, that it's affordable. These are very big challenges, I think, frankly, in this time. So engaging on those 2,000 pieces of legislation, of which typically about 10% are healthcare related, is something that's important to do. Because again, there's organizations that are going to speak to, the role of doctors in the system, very important. We do a lot of work together. The role of the health plans themselves, again, very important. We do a lot of work together. But it's important to look at it through the lens of how it's going to impact, enrollments, availability of coverage, affordability of that coverage, how it would be utilized, especially when you're dealing with something that may have overlapping federal concerns or local implications, which is a great model that CAHIP has, where you have membership when you join at the national level as a member of NABIP, at the state level as a member of CAHIP, and then as you indicated through your leadership role with a member of a local association, because healthcare, at least certainly points of access and affordability, are very regionally driven. And we want to make sure that we're responding to those issues as they emerge coverage, things like a Medicare plan, no longer offering coverage at a popular facility. That creates a crisis in a community, and agents are really well poised to speak to what resources are available to address the consumer's need in that. And I think we'll be able to talk about a piece of legislation that did just that this past year.
Okay, great. And you mentioned this before, but I want to come back to it just so that people understand how important this is. You mentioned the deficit spending here. So let's talk a little bit about the budget process again, just kind of expand on what you talked about before. Can you tell us how that works, the whole budget process, and how they can't deficit spend? What does that mean? And just inform our listeners and our audience, our video audience now as well. Why is that so important?
Sure. So again, for those of you who largely follow national politics, you're very aware that the country is, X trillion dollars in debt. And they're able to do that because they can deficit spend, right? Again, I'm not going to get into the complications of people, print more money, borrow things, debt, all those types of things, but that occurs at the federal level. It can't occur at the state level. So when we have budget woes here in California, again, there is some borrowing, there is some delayed spending, but we can't do it certainly to the extent that the federal government can. So when you have a fiscal crisis, you're really looking at the single taxpayer dollar needing to go towards which critical public service. Do you fund wildfire suppression? Do you fund a new health benefit? Do you fund education? Those things are really challenging. So a lot of the, expansions of benefits, those types of things are better done at the federal level because then they can help to augment that with the financial responsibility. If California, exceeds those benefits, we have to pay for them. And then that dollar is restricted from being spent on anything else within the state, which is a balancing act, just like families do, when they're looking at what they're able to afford, what they're able to spend money on, what's a want, what's a need, what's a future hope. That is a method that we have here in California.
Okay, thank you very much for explaining that in more detail. I really appreciate that. Now, we've had a lot of single-payer threats over the years, of course, here in California. And because of these budget constraints, so to speak, that's really an important thing. And that's basically, for the most part, what killed a lot of those movements was the fact that it was going to cost so much money. But can you give us a brief overview of some of the single-payer threats? And can you tell us if CAHIP is concerned at all right now, if there's going to be another round of single-payer threats in the future? What are your thoughts on that?
Sure. I think I'd like to speak to a couple different points. One, the typical sponsors of single-payer legislation in California are the California nurses, and they've indicated this year that they're not pursuing the legislation, that's a point of education for the legislature. Because as I mentioned, and as we talked about at the beginning of the podcast, just this past November, we had a new class of elected officials, and because of term limits, there's been a lot of turnover. That is really important because about a third of the legislature is brand new. So there is a lot of education that happens when folks become newly elected. There was some disappointment expressed by, longtime supporters of single payer with their decision not to pursue the legislation this year. But again, I think a lot of it does tie back to the budgetary woes you expressed and frankly to the Trump administration. Proponents of single payer, including the nurses, have long time said that the federal government would need to fund about half of the single payer system in California by allowing California to pursue and receive waivers that would turn over all of the Medicare spending dollars we get from the federal government and our Medicaid system, Medi-Cal. All those dollars would need to be siphoned into a single payer system in order to prop it up to pay for half of it. The state would have to pay for the other half. Those systems, as they've identified them, because they're supposed to have no cost sharing, no premiums, no deductibles, none of those things, which again make it very difficult and very expensive when you're going to have to front load it, largely front loaded through taxes, which is a point of conflict. It's certainly not very popular in election times, but I think we can all assume that a Trump administration is not going to hand California a blank check, especially using all of the money that's currently allocated towards Medicare and Medi-Cal. So it's pretty much a no-go. In fact, a few years ago, the California legislature did pass a piece of single-payer legislation called Senate Bill 770, which basically said that the state does need to pursue the waiver process and to create waiver for requests for the federal government in order to be able to receive those Medicare and Medi-Cal dollars and amongst other federal dollars we receive. So care for CHIP or for the VA. But that report wasn't due until after this presidential election. And now that we know there's a Trump administration, it seems very unlikely and like that would be wasted effort. California did ask when Governor Newsom was first elected and Trump again was in his 1.0 presidency. California had asked for a type of this consideration, and I think we all know the outcome was not a yes. So I think that a lot of the single payer proponents view it as wasted effort at this time.
Okay, well, that's good to know. I mean, for people that do what I do, obviously, benefit brokers, consultants, and so forth. That's good news for us. So that's good news to hear. I assumed that would be the response, but I wanted to make sure that our audience was familiar with that. I know that you haven't had your annual bill review yet. That's something that CAHIP does every spring. And they basically get together in a room and have the legislative chairs from every local chapter and a lot of people from the state board and so forth. And you all get together in a room and you go through and pre-assign. I know I've been in that bill review process before myself. You assign certain bills to each of them, right? And they all have the ability to go back and they're supposed to say, okay, we're going to study this and see what it means. And then they get together in that bill review and then you talk about it and you decide which ones CAHIP wants to support, which ones you want to not support, oppose, and which bills you want to stay neutral on. And that hasn't happened yet, I don't think. I think that's next month. But can you tell us a little bit in general on what CAHIP is tracking so far that you anticipate most likely will be on those lists, things they should support and oppose and so forth? Are there certain types of themes or whatever that you look at when you're going through this process that our audience might want to be aware of?
Sure. So we are a little early, in part because the legislature doesn't have their bill introduction deadline until February 21st, which at the time of the recording is this coming up Friday. And the legislature oftentimes operates like a high school and they wait until the deadline. So we typically see about 1,000 of the 2,000 bills introduced within the last 2 days. So there's a lot yet to come. California also utilizes the process where people introduce basically a blank bill that we call a spot bill, and then later amend in the language. There's, I would say, maybe 1 in 5 or 6 bills are, empty at this time, and the language does eventually go in. So we're a little early, but there is one thing I specifically want to flag for your Medicare folks. And I can't speak to bill positions yet, because again, with a professional client, I would never say they're supporting or, opposing without having received that official directive from the Legislative Council and then, of course, the board approval. But because one is a near identical introduction from a bill that CAHIP was very concerned about last year. Last year's bill was Senate Bill 1236, and this year it's been reintroduced as Senate Bill 242. And as a state lobbyist, I don't get a lot of opportunity to work on Medicare issues because it's so, heavily federally regulated, but things around enrollment is certainly where the state does have an opportunity to engage. And this is one where it would have a huge impact. So Senate Bill 242 does something that sounds great on its face. When you first hear it, it sounds like a wonderful thing for agents and for consumers because it would require 2 periods of open enrollment for Medicare supplemental coverage. So Medigap or MedSup. Senate Bill 242, and again, this was the talking points we also had for Senate Bill 1236, would establish a new 90-day annual enrollment period with guaranteed issue for seniors and individuals with disabilities seeking to get Medicare supplemental coverage. So initially it sounds on its face like, great, you're going to make coverage, more available to folks frequently. However, there's a resource that we very heavily rely on in California called the California Health Benefits Review Program. It was created by the legislature to take a look at legislation and to identify the impact that it would have on premiums and on utilization and system health. And this review is really important because the state itself only looks at the cost to the state when it looks at programs. But we are also interested as policymakers and as stakeholders on what the impact to the system would be and what the health of the system would be. And basically, CHIP identified what we were concerned about as agents with the impact of that legislation being that you would see a dramatic increase in the cost associated with Medicare supplement plans. They estimated that it would be at least a 33% increase, which is very significant when you're talking especially about seniors who are oftentimes on a fixed budget. A 33% increase would be very dramatic. Yeah. And because of that increase, and because you would be able to access it every year only when you need it, you would probably see reduced enrollment in Medicare supplement plans by anybody who is healthier or maybe younger and who was securing that coverage for a later time when they would need it. So you would have an adverse risk selection mix, and then that would also lead to insurers withdrawing from the market. So that's really three huge pain points for CAHIP and our members. We don't want to see costs go up. We don't want to see carriers leave. And you want to make sure that the decisions, that we're looking at, pieces of legislation, are still ensuring a healthy risk mix, because we know that contributes to the overall health of the system. So we oppose that legislation, even though we understand the reason it was brought forward based on some happenings in the San Diego area, where a very popular facility no longer was accepting Medicare Advantage plans. But we were able to communicate to the legislature that there were already solutions within the existing system that were available when you have restrictions of access, that you can already go into when you work with an agent. You can go into Medicare supplement at that time if you have a loss of access or an increase in price, which certainly there would be in these situations. So this proposal, though intending to fix a problem, was not the right solution and would do a lot more harm than good in terms of those things that the Jaburp analysis also identified. And in fact, one of the benefits about working with a national association is we were able to look at rates in another state. For example, New York already has this policy. They have drastically fewer carriers, and their plans are double the rates of ours. So again, even though it looks like what the legislation is doing is making it easier to enroll for folks, because guaranteed issue just frankly is a lot easier. And if it's happening annually, people are kind of familiar with that concept, for the under 65 market. But this market becomes a lot more complex, and we were able to share that with the legislature. So I imagine we'll be relaying similar concerns this year as agents are doing the best they can to protect the seniors they serve.
Yeah, that's really important. As you said, that 33%, that's a lot. I mean, they're on fixed incomes, as you said, and that's
groceries. That's your light bill.
That's the difference between being able to keep electricity on in your house, keep your heater on, and keep your that's a lot. That's a lot. I'm glad you brought that up. Are there any other bills that you think will be coming back that we should be aware of?
With the relayed message that we're not expecting single payer, I think we always see benefit expansions proposed, but again, with the budget deficit, you can't commit to future ongoing spending. And it'll be a challenge for California to meet its current spending obligations, again, with the significant amount of resources that are going to be needed in Southern California. I do think it is a bit of an education and a transition year about how is California going to work with the Trump administration and vice versa. We obviously have new leadership there at the federal level too, with Robert Kennedy's confirmation recently happening. So I can't speak a whole lot into the crystal ball at this point about what's going to be coming forward, but I wouldn't expect to see a lot of benefit expansions. Something that we are tracking here in California, though, is for the first time in over a decade, California is reevaluating its designation of essential health benefits. So California has a piece of legislation going through the Senate Bill 62 by Senator Menjivar, and Assembly Bill 224 by Assembly Member Bonta. Those are the respective chairs of the health committees in each house. They are examining what benefits California should be including as its benchmark for essential benefits here in the state. We've seen a number of proposals for things like children's hearing aids, other benefit expansions, but you have to consider the, kind of the weighted impact to the system to provide access and maintain cost affordability. So that'll be something we're tracking very closely here.
Well, thank you for that. And for those of you that may not be aware, the Affordable Care Act, which is where the essential benefits information came from, was signed into law in March of 2010. So that is basically, we're coming right up on the 15-year anniversary or birthday of the Affordable Care Act. So I think it's important for people to be aware of. So thank you for that. I'm going to ask you a non-legislative question, if you don't mind. Could you take a moment and just tell our audience about, again, something we talked about in the beginning, but I want to come back to it. CAHIP is an organization that you said is for agents, brokers, and industry personnel to be a part of and so forth. And why is it so important? And what would you say to those listening that are brokers or agents and brokers that aren't members? What would you say to them about why they should become a member? And also to employers that have their brokers helping them and they're not CAHIP members, what would you say to the employers as well?
First of all, I would thank employers. It's very difficult, especially if you're, an employer in California. It can be challenging. My husband's a business owner. I know the late nights a lot of folks have, and the work of agents. I, again, have been working with agents for 9 years now, and I see the constant calls and emails and communication. And in fact, a lot of my communication with them is very late hours or wee morning hours as they're doing it after their real jobs, right? Helping folks. But it's important if you are at all concerned about the affordability of healthcare, about issues of access, about any issues surrounding equity, you need to be engaged through an association so that it's not just an individual, though I would encourage all of you to get to know your legislators. I love civics, would never want to discourage that. But there's something about coming together, with a corporate voice saying this matters. And I'm putting my personal time, my personal dollars to communicate to you what this impact of the legislation that you're trying to do, like that Medicare bill, for example, would have in the real world. And unless you engage, and really agents are the perfect people to do that, and those that support agents to bring that voice forward, that's an informed voice. There were a lot of consumer advocate type groups on the other side of that legislation supporting it because, again, it sounds fantastic, but agents were uniquely positioned to talk about the impact that it would have on premiums and to speak from experience on what it would do to restricted access. And as people that, professionally try to help individuals when there are crises, at the local level, like a loss of access to care, that an agent has tools that they're licensed to do in order to help somebody maintain that care, to be able to continue to see their provider, to be able to receive treatment at the facility that's close and available to them. We know how disruptive it is when those issues aren't addressed because it's really the agent across from you that's handling it when that crisis occurs. So I would say don't ride the bench, even though thank you for the work that you do, don't ride the bench of, others that are giving their time to make sure that the legislation that passes here in California has been considered through the lens of a professional who knows maybe some conflicts that would occur at the federal level, or we see that all the time come up in our bill review, like, oh, this would put us out of compliance with HSA regulations, so we need to change it this way. Somebody has got to engage, and this association is really a platform to do so. So get engaged. It is important work, and you'll receive a lot of other benefits in terms of mentorship, resources. You'll, I think, be really impressed.
Yes, I think so too. And I just wanted to mention the employers too, because obviously this all has to do, even though we're talking about CAHIP is representing agents and brokers and industry personnel. But again, that ground level, what they're really doing is protecting the consumers and those employers that are health plan sponsors. I think it's really important that they understand about being involved with a national, a statewide, and a local organization, how beneficial that can be to not only the agent community, but also to the employers and the consumers that they represent. So thank you for that. I just want to make sure people were aware of that. I know that we've taken a lot of your time today, and I really appreciate it. If people would want to reach out to CAHIP or to you, what would be the best way for them to do that?
Yeah, I would encourage folks that are interested in CAHIP to go ahead and visit our website at CAHIP, CAHIP, California Agents and Health Insurance Professionals .com. Or if you're interested in membership, you'll be directed to pursue that through our national organization, which again then makes you a member of the state and the local level at NABIP.org. So National Association of Benefit and Insurance Professionals. You can get a lot of information there, or you can always connect with me on LinkedIn. I'd be happy to chat with folks.
Okay, great. Thank you so much. And again, thank you for sharing all this wonderful information with us. And for me, it's fun because it's like old times, right? We get to actually chat because I don't get to talk to you as much nowadays that as I did when I was on the state board. So it's really good to see you. You look fabulous. Again, congratulations on the little one, and keep doing all the great work that you've been doing for CAHIP for all these years. And I can't wait till next year till we can do this again. And again, if something big comes up and you think that people need to know about it, contact me. Even if we're off season, we can still do a special episode mid-season if we ever need to. So just, keep that in mind. We love having you here, and you're one of my favorite guests. So thank you for being here today.
Thanks for having me, Dorothy. You'll be my first call.
Thank you. To everybody else out there, please stay safe, stay healthy, and stay tuned for the next episode of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Anaheim, California. All views expressed are those of the host or interviewees and not necessarily the views of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Cociu can be reached at 714-693-9754 extension 3 or toll free at 866-658-3835. By email at dmcociu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.